Assalamualaikum warahmatullahi wabarakatuh. Our research title is Factor Influence the Recovery of Drug Addiction Among the Ex-Drug Addict Registered under AADK Kerian Perak. This research was conducted mainly by two researchers. The first researcher, Muhammad Addicts bin Muhammad, and me, myself, Khairul Izzat bin Abdul Aziz as the second researcher. We personally do hope that panels and examiner for this research enjoy on our research presentation. So without further ado, let's take a look first on the background of study for this research. According to Monian, drug is one of the main use for the purpose of medical. It will use both in traditional and modern medical in the context for the medicines. But then, there is illicit and abuse of drug happens among the people with their use for the inappropriate intentions. So, AADK Kerian is one of the branches of AADK located in Perak. According to Muhammad Noor 2020, National Anti-Drug Agency or AADK become an important agency in eradicating and provide a treatment. Therefore, we have done this research in AADK Kerian as to identify the factor that will influence the recovery of drug. Probable statement. So, according to Muhammad Noor 2020, more than 70% of heroin users were addicted with drug, and some of them involved with HIV/AIDS. Even the number of overdose deaths by drug increases to 9.6% in 2017 from the previous year. So, the drug abuse activity were treated the community safety since it contributes in a crime, in which these are the major concerns of the problem relate with the drug abuse. Hence, there is a need to solve this drug abuse problem. There is a declining number of drug addicts from 2016 until 2020, where the record shows that more than 10,000 people get recovered. In the context of AADK Kerian, as shows in the table 1, around 31 people has fully recovered without any repeated issues of drug consumption. The first research question, what is the level of drug addict awareness on the impact of drug addiction among the ex-drug addict registered under AADK Kerian? Second research question, what is the relationship between self-development, effort, and the recovery of drug addiction among? Third research question is what is the relationship between the physical pain and recovery of drug addict among the ex-drug addict? And the fourth research question is what the relationship between the spiritual program and the recovery of drug addict. And the last research question, which is the fifth research question, is what are the most significant factors that contribute to the increase of drug addict recovery. The first research objective to examine the level of drug addict awareness on the impact of drug addiction among ex-drug addict registered in AADK Kerian Perak. Second research objective is to examine the association between self-development effort and the recovery of drug addiction. For the third research objective also to examine the association between physical pain and the recovery of drug addiction. And for the fourth research objective is to examine the association also between spiritual program and the recovery of drug addiction. And for the last research objective, which is the research objective for the fifth, is to examine the most significant factor that contribute to the increases of drug addict recovery among the ex-drug addict registered under AADK Kerian Perak. So the first research objective, we use the descriptive statistic. And for the research objective for number 2, 3, and 4, we use the Pearson correlation coefficients. And for the research objective for number 5, we use the multiple regression as we want to know the most influence and factor that contribute to the recovery of drug addict. Substance Abuse and Mental Health Service Administration 2012 has defined the recovery as a transition process where people enhance their health and wellness as to seek and realize their full potentials. According to TUNKU and Khairul 2020, the self-development effort is the most influential factor for the drug recovery, since it enables the drug addict to fight with their own body for the purpose of recovery. Self-development effort refers to a rational decision that made by an individual as for their sake of future life. Thus, this reflects with the drug addict effort who want to recover from the damages that they have done toward themselves. According to TUNKU and Rahul Singh 2020, physical pain involved with emotional distress and direct physical suffering which can influence the drug recovery. They mentioned that drug addicts will tend to have emotional distress such as sadness, restlessness, anxiety, sweating, and cramping during the period of consumption. Thus, they have to stop consumption of drug in order to stop those pain. Thus, it shows that consumption of drug in life could lead into several problems, as mentioned by Adrian and Berry 2003 and also Socrates 2006. According to Cook 2004, spirituality is a key variable in the etiology of treatment of addictive disorder, relate with humanity's soul and relate with meaning of the life. Chan 2006 said that spirituality could reduce the intensity of negativity, especially on the emotional among the drug addict. Conceptual framework. As for this figure, we can see is that at the left side, it is independent variable and it consists of three variables which are self-development effort, physical pain, and spirituality program. All these independent variables will be measured for its influential of the recovery of drug addiction as a dependent variable. Research methodology. For the research design, we have used the quantitative method. For sampling technique, we use the simple random sampling. By using this sampling technique, it enables us to select the respondent randomly in the Aadk Kerian. So for the measurement and instrument, for this research questionnaire, we have separated and divided into 6 categories. For the first category is section A, respondent demography. We use the nominal and ordinals. For the section B, respondent relation with Aadk Kerian. Also, we use nominal and ordinal. So for the section C, D, E, and F, we use the Likert scales, which relate with drug recovery awareness, self-development effort, and physical pain and spiritual program. I would like to mention that for the Likert scale, we have used the 4-point Likert scale, in which there is no natural section in the Likert scales. So for the sample size, the population for this research is 340 of ex-drug addict registered in Aadk Kerian. And the sample size, we have used the Craigie and Morgan 1970. And the sample size will be 181 respondents. For data collections, we have used primary sources as we do a physical form and Google form questionnaire for online method as to get and receive the respondent feedback. We also use the secondary sources by receiving the input from published articles, research, journals, and data analysis. Both of us use SPSS version 26 as to run the descriptive statistics, Pearson correlation, coefficient, and multiple regression in the chapter 4.
Alright, the first finding and discussion can be looked in terms of the demographic profile of respondents, in which the gender of male shows the highest involved in this research. Thus, most of the respondents are in the age of 19 until 30 years old, and the majority of respondents are self-employed as well as having SPM as their highest level of educations. Then we move to the first objective of this research, in which, based on the findings result, the mean score for the first until the sixth question are moderately high and within the range of 3.01 until 4. Hence, the average mean score for the first objective is 3.6, and it shows that the level of drug addicts' awareness on impact of drug addiction is moderately high, and this is supported through study made by the Taran, Sabrina, Trent, and Jessica in 2018. Next, the final result of the second objective shows that there is a moderate positive relationship between the self-development effort and the recovery of drug addictions, since the result shows R equal to 0.542. Besides, this is supported by the TUNKU and Rahul in 2020, which said that the one and most of the important factors that influence the recovery of drug addiction is through the self-development efforts. Besides, the finding result of the third objective describes that there is a moderate positive relationship between physical pain and the recovery of drug addiction, since the value of correlation coefficient shows R equal to 0.485, and this is supported by DuPont and McGovern in 1992, which concluded that these symptoms of emotional distress such as anxiety impact made the addicts expected to experience the withdrawal of drug consumptions. Furthermore, based on the findings of the fourth objective illustrate that there is a weak positive relationship between spiritual programs and the recovery of drug addiction, since R equal to 0.395. Thus, this finding is supported by Amin and Saleh in 2014, which mentioned that the spiritual program is an effort for a therapy for healing improvement, such as the activity relates with zikrullah. Moreover, the last result from the last objective shows that the family factor is most contributed, as the standard data values for the self-development effort is 0.389, which is highest as compared to the physical pain and spiritual program. Hence, this is supported by Garner's, Scott's, Dennis, and Fang in 2014, which recommend the drug addicts to be focused by the element of self-development effort to ensure the better outcome of recovering from the drug addictions. However, the first limitation faced by the researchers in this research is the lack of participation from the drug addicts in answering the physical questionnaire during the monthly meeting. This can be seen when there is a low attendance of the drug addicts through the Aadk Kerian self-report, in which had caused the difficulties and require a lot of time for collecting the data from respondents. Next, the other limitation is in terms of the lack of accessibility and barriers in collecting the information for this research, which some of the articles may need to have some approval before able to be accessed, and also require such payment to be made, even though it has been assisted by the librarian staffs. Therefore, one of the recommendations is through enhancing the brainstorming program for the better approach with the drug addicts, in which such agency needs to identify the accurate method in aiding the recovery of drug addicts. For example, encourage their self-development by coming up with the plans of career development to develop themselves with the better future. Besides, the other recommendation is through increasing more religious activities to provide moral support for drug addicts. This is because it will enhance their recovery from increasing their spiritual spirits. Thus, by putting the element of calmness, can encourage drug addicts to recover slowly without any coercions. Alright, in conclusion, this research paper has provided a research study on the factors that influence the recovery of drug addictions among the drug addicts registered under Aadk in Kerian Perak. And by that, the researchers have discovered 3 factors, which are the self-development effort, physical pain, and also spiritual programs. Besides, this study has provided a new insight on this topic, which can be used as reference for future research.